important time, especially for the world, navigating all these complexities. We saw with the budget cuts really affecting so many countries and really just causing quite a havoc. But of course, it's not the time for doom and gloom. Joining us now is UNAIDS Executive Director, Ms. Byanyima. Thank you so much indeed for your time. And I suppose the very first question is the impact to the budget cut. How is the world doing with a very, very critical time and so unprecedented as well?
Thank you. Aid has been declining over time. We always knew that aid would end, and now there has been a severe disruption in the HIV response, but generally aid has been declining. And I see that what's important today is to first accept the reality that aid was going to end, do the analysis of what the gap is in the HIV response or in health broadly, where the disruption has been, and then get on with filling that gap. I see many African countries taking the right steps of filling the gap, in spite of the severe constraints they have on their budgets. I see here South Africa, a very good example. It has lost 17% of its budget for HIV. It came from support by the United States government, but I've seen through this visit remarkable efforts to fill the gap. And I see commitment from all sides, civil society, government. I see real efforts to close that gap. We need to focus a lot on prevention. That is where we have slowest progress. There's more progress on treatment, adherence to treatment. But overall, I'm optimistic that Africa will find solutions. We wasn't going to remain on aid forever.
And obviously, ma'am, you spoke about the issue of South Africa leading, for example, around the replenishment fund in terms of making sure that the world is not seeing setbacks, and be able to counter those setbacks. And you've interacted with President Ramaphosa, especially critical time for South Africa, for Global South, with the G20 presidency. What has been that discussion been like, especially around South Africa's priorities?
I congratulated President Ramaphosa for his global leadership. This is not an easy time for African countries that are highly indebted, paying more to service their debt than they can put in the health of their people, but yet he has stood up to lead the Global Fund replenishment. This is a big responsibility he's taken on. We're supporting him. We're going to be calling on the countries that are richer to put down the resources we need to end this disease. HIV is a global pandemic. It has to be solved by global efforts. And so I was very happy to meet the president and congratulate him on taking up this leadership role at a very difficult time. Secondly, I also congratulated him on his leadership on G20. President Ramaphosa has made 3 priorities: solidarity, equity, and sustainability. Again, at a time when the world needs that message that stay together in solving global problems. Multilateralism is critical to solve global problems. This is a time when we are seeing countries pulling back instead of coming together to solve problems. Inequality is driving poverty. Inequality is roasting our planet. This is the cause of many of the problems we have today, widening inequalities, and then, of course, the sustainability of our planet. So I congratulated him and offered our support, particularly in the question of resolving the debt issue for Africa.
And I would imagine, ma'am, it's still quite a long journey. I mean, if you talk about 7.8 million South Africans who are facing this particular disease, but also about 6 million also receiving the life-saving support in terms of the ARVs and stuff. And also, you mentioned that last year we saw about 150,000 infections. So surely it's still quite a very long way in terms of tackling this big issue.
I see it differently. It's not a very long way. South Africa came to the table on this disease late, but South Africa came with ambition to save lives. 7.8 million people are living with HIV, the highest number in the world, but 6 million of them are on treatment today, paid for by their own government. Again, we do need to fight harder on the prevention side, because 150,000 new infections every year, a lot of them are girls and young women. That is a high number. And so, yes, there's a challenge on working hard to prevent. And again, I see real efforts here. I saw in Soweto at a clinic when I went, a youth space in the clinic, and I was told that all the clinics have this youth space because young people are the most infected, where they can get services that are youth-friendly. These are the sort of things you need. But you also need to address the social norms that drive this pandemic. And you need to have the interventions that also protect girls and young women, like staying in school. Like tackling gender-based violence. Again, your president is a champion and has been putting himself forward as a champion against sexual and gender-based violence. We know that leadership is important, but also putting the resources there for prevention and for response to sexual and gender-based violence. All these things are happening. I am an African optimist. I think we will get to the end of this disease, but we still need global solidarity.
And just before I let you go, ma'am, you spoke about the new tool in terms of preventing, the new tool being created, but I would imagine the issue of cost in terms of making sure that it's accessible to all people across the world. I'm sure it's still quite a journey to reach that point where access is widened.
Yes, I talked about this tool that I call magical, or a miracle. That's lenacapavir. It has been proven, it was tested here in South Africa, it has been proven to be 100% efficient. It's an injection taken twice a year, and when you take it, then you will not be infected with HIV/AIDS with 100% efficiency. However, as you said, Gilead, the producer, is hiking the price. And we are saying to Gilead, hey, be on the right side of history. License many companies globally on every continent to produce this in mass quantities so that the price comes down. We're told that the price might be $25,000 per person per year, first in the American market where they can afford. And we're saying we need this tool here. The disease is here, and we know from the researchers that the price could be even just $40 per person per year, and even could come down to $25 per person per year as the market grows. So we are calling on Gilead to license companies in this country with the highest burden, with the capacity, technological capacity, so that we start producing for our continent. We are also saying to African leaders, integrate the market first, harmonize standards so that a producer can supply the whole continent. You cannot compete with India when you're supplying one country. So yes, lots to do, but first we challenge capitalist greed, that maximizing profits should not come before saving lives.
All right. Ma'am, thank you so much indeed for your time. And of course, it's all about building that self-sufficiency, producing the vaccines right in Africa, but also creating those desperately needed jobs as well. Kylie Kumala, SABC News, Johannesburg.